Hi, we're Group 12 presenting on obesity in America. Here is the agenda for today. The Mayo Clinic defines obesity as a medical condition involving an excessive amount of body fat that directly increases one's risk of health problems such as heart disease, cancer, and depression, to name a few. How is obesity measured? The most common method is to measure a person's BMI. As this quote states, obesity is a significant issue. Our growth trends are increasing, whereas other developed countries' growth trends are leveling off. Data from the CDC shows that 18.5% of children and adolescents are obese, which equates to about 13.7 million individuals. This slide also breaks the issue down by age. Notable disparities exist within childhood obesity. For example, Hispanic and non-Hispanic Black children had higher obesity prevalence than non-Hispanic white children. Looking at the age-adjusted prevalence of obesity amongst US adults, there were no significant differences by age group. They all maintained around a 40% prevalence rate. This next graph shows the prevalence of obesity in adults by race and Hispanic origin. Non-Hispanic Black adults had the highest prevalence of obesity at 49.6%. This data supports the idea that some groups are more impacted due to varying SES.
The Let's Move campaign was an initiative by former First Lady Michelle Obama dedicated to solving childhood obesity. The big goal of this campaign was to reduce childhood obesity by 5% by 2030, and it was based on the 5 pillars seen on the slide. In order to address these pillars, the Let's Move campaign created a series of programs all centered around the idea of addressing nutrition and physical activity. They equipped schools with resources and tools to increase physical education, give children daily access to fresh fruits and vegetables, and much more. They even collaborated with Beyonce to create a song that encouraged kids to dance and exercise all across the country. The Let's Move campaign advocated for many important policies that are present today. The campaign played a large role in pushing the FDA to require transparency on nutritional information labels for packaged foods. They also strongly advocated for the Healthy, Hunger-Free Kids Act, which most likely has impacted the majority of us. It updated school meal nutrition standards for the first time in 15 years and increased funding for the first time in 30. American public schools now offer healthier school meals for over 50 million kids, with more of those kids being eligible for school meals at little or no cost.
Aside from the Let's Move campaign, there are several other programs that target obesity. The SNAP Ed program, aka CalFresh Healthy Living, is a federally funded grant program and is the largest nutrition program in the US. Ultimately, the goal for this program is to teach eligible low-income individuals about good nutrition and healthy lifestyle choices to prevent obesity. This is done through complementary direct education, multi-level interventions, and community approaches. 45% of low-income Californians were unable to afford enough food in 2016, and 61% of low-income California adults are overweight or obese. Thanks to SNAP Ed, 1/3 of Californians, or 12.6 million individuals, are SNAP Ed eligible. Here are some recent SNAP Ed accomplishments. SNAP Ed taught preschool kids about nutrition and physical activity through interventions and face-to-face education in Maryland, and provided safe and healthy food for residents in Plymouth, Massachusetts during the COVID-19 pandemic. Furthermore, in Western Maine, CSFP is working with a local community coalition to enrich the diets of low-income seniors by enhancing monthly food boxes with farm-fresh fruits and vegetables and healthy, non-perishable pantry staples.
So, where can people go to seek care? As discussed in class, your first point of contact should always be your primary care physician, who can refer you to obesity specialists for more targeted care. 3 common treatments for obesity are 1. Dietary modifications to form a calorie-restrictive yet nutritious diet, 2. Weight loss medications to curb one's appetite, and 3. Bariatric surgery to decrease the size of an individual's stomach to limit food consumption. Now, let's break down some common misconceptions. This first one addresses BMI as a flawed measure of obesity. For instance, in sumo wrestlers, BMI fails to account for their rigorous training programs intended to build muscle mass, meaning these athletes have high BMIs but are actually metabolically healthy. This next misconception addresses the 2 most commonly studied risk factors for obesity, known as the Big 2. Recent studies have shown that other risk factors, such as insufficient sleep and psychological stress, also significantly contribute to obesity. To combat obese individuals from being negatively stereotyped, the general public must be made aware of how society's portrayal of obesity may lead to discrimination, and more research must be conducted on other risk factors for obesity. Thank you. And these are our citations.